Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
We would like to get started so we can share our story.
I just wanted to say my name is Tiba, and I'm happy to be here. But I haven't had a very good experience so far. But I know it's going to turn around, and we are going to be talking about a population that is forgotten a lot. And at the agency I work for provides services for people, mainly adults with developmental disabilities, and we can't use the word sex, basically.
Hold up your name tag.
Yes. Okay, so I came here, found out that I was registered, not registered, so they gave me a name tag to write my name on, and I decided to leave it blank because the people who I work with are invisible, the population that we're talking about. And that's why it's so exciting that I'm here with Sierra and Evelyn, because you know what? We might be able to make a dent in improving things for them. They are forgotten. And my name is Tiba Walter, and I think I'm going to go ahead and turn it over to Evelyn.
All right. Do you want to introduce yourself, or do you
Yeah.
want to go ahead?
Yeah.
Okay. You go ahead.
Okay. My name is Sierra Olivia Thomas Williams, and I am a prevention specialist at Indiana Coalition Against Domestic Violence. And we are sub-grantees of the Indiana Department of Health for the Rape Prevention and Education Grant. And I'm going to be sharing with you a project today, and I want to let you know how upset I am right now. The only way that I can share with you the work that has been done is through technology, and we prepared a really awesome presentation for you, and this wasn't set up. So we are troubleshooting that, but that's just another barrier for giving you the story of very vulnerable populations in the United States. Evelyn.
I'm Evelyn Smith. I work for a local combined DV sexual violence agency in Central Indiana. I work alongside Tiba and Sierra doing projects preventing sexual violence among a variety of populations. But today, we're going to talk about preventing sexual violence in populations with disabilities. Before we actually get started, I'd actually like to give you all a chance to get to know one another. We'd have instructions up on the board, but we don't right now, obviously. So what I'd like you to do is get in groups of about 5 or 6, right? So it can be people sitting right next to you. It doesn't have to be. All right, so I'm going to highlight using this activity, right? Why do you think we use this activity? Thoughts? Real quick. It's also okay if you don't have thoughts. Networking. It's important, right, to recognize that this is a way you can actually connect with others. So when we introduce one another, we're often we start with our credentials, right? That's super gross. It's really like hierarchical. It emphasizes who's more educated than who has a higher rank than who. This puts everybody on an equal ground. This is actually the specific group introduction icebreaker that we do when we work with groups at Stonebelt. So with bouncing back, which people will talk about a little bit later. It's also real. It lets us realize that we're bringing baggage here and helps us sort of mentally prepare to put that aside. Sorry, I'm working off my phone. All right. So I appreciate everybody working with us on that. I hope you have a better sense of who your fellow conference goers are. I have not introduced myself at any other session, so maybe some of yours have, but ours have not, or mine has not. All right. So, as you're probably aware, we're here to talk about social inclusion strategies for sexual violence prevention in the context of working with adults with disabilities, right? Makes sense? So you cannot see the slide. It would be up there. What it says is from sidewalks to sexual violence prevention. We use that slide because that's the question we keep getting, right? how are they related? Because we end up going into the community, we end up talking about sidewalks, people say, well, how are you actually preventing rape? I want to talk about that a little bit. I want to talk about it quite a bit. People familiar with the so-called public health approach towards solving problems?
So-called.
Say what?
What do you mean so-called?
Oh,
It is the public health approach.
Yeah, fair enough.
It's not a so-called
Right.
approach.
Did I say
She's with
so-called?
the RPE.
Okay.
Yeah.
Fair enough.
It's one approach, whether you like it or not, it's still an approach.
I like the calling out that's happening right now. This
Yeah.
is a safe place for that to happen. It's working!
Inclusion is working.
So, for those of you who feel like that's a really strong framework for you, right, that means a lot for you, I want to give you a sense of how our project worked along that axis. So the first step, define the problem. Probably all of you are aware. So our problem, as we defined, high rates of sexual violence among adults with disabilities. Right. So we'll have stats about that later, but you won't be able to see. Next step is strategizing around shared risk and protective factors. So one thing we looked at were many different risk and protective factors that are associated with different kinds of violence. So one that shows up for many different kinds of violence is isolation, right? And again, we have stats for that later for those of you who are skeptics, which is fair enough. So we have that risk factor, the corollary protective factor is social inclusion, that works protecting people against a range of different kinds of violence, right? So that's what we decided we wanted to focus on. So we developed a project related to that, the details of which we are going to talk about, give you some information about how our project works. We're currently in the process of assessing the effectiveness of the strategy. The project runs to the end of the year, right? So we've still got some time left to figure out sort of exactly what did work, what didn't. However, we want to start disseminating our process because building a knowledge base is a process that one person can't do, that one project can't do. We're hoping what you take away from this is a sense of how you can replicate this kind of project in your own communities. Does that make sense to people?
Yeah.
All right. So, show of hands or fingers or toes. Who would agree with the following statement? The structure of society makes certain kinds of violence more likely to occur or more difficult to prevent or punish. All right. If you're not on board with that, probably this isn't the best presentation for you. Probably not the best conference. All right. So our radical suggestion is that the kinds of interpersonal violence we're familiar with also play out in structural ways. So, people are probably familiar with the power and control wheel. People seen that? Right. It's a way of describing different tactics for power and control. Thank you, Sierra.
Thank you.
Yeah. One of the wedges on the power and control wheel is isolation, right? So we would like to talk about how isolation, which is usually thought of as interpersonal, functions on a structural level. Who here works directly with clients? Okay. Even those of you who don't are probably familiar with sort of how this plays out. So on an individual level, what does isolation look like? It can look like a person who doesn't know anyone to drive them to a doctor's appointment. It can look like a person who is assaulted or harassed on a bus and no longer feels safe riding on the bus. Like a person who is unfamiliar with their neighborhood and struggles to connect with their neighbors or make friends. But those all also function on a structural level. So a person who doesn't know anyone to drive them to a doctor's appointment should have a public transit system, right? To get them there even if they can't rely on a friend. That's a structural isolating factor.
Oh.
A person who is assaulted or harassed on a bus, that bus driver should have had training on how to do nonviolent conflict intervention, right? Or a person who isn't able to connect with their neighbors, make friends, right? One of their problems might be the condition of their neighborhood's infrastructure. So parks, roads, sidewalks, things that allow them to access public spaces. Because those are where we interact. I gave examples of ones that are considered truly public spaces, but a bookstore is also a public space. Fast food restaurant is also a public space, right? And when our infrastructure doesn't allow people to access those spaces, that is structurally isolating. So, I recommend you download this because that's got linked to a couple different studies. I don't have to use my phone anymore. All right. So, how does this relate to sidewalks in particular? So sidewalks are one of the most frequently identified. Can I use that?
What?
So it has notes on it. Sidewalks are one of our most frequently identified barriers for the adults with disabilities that we worked with towards accessing public spaces. So they identified a lot of different ways that functioned, but it looked like sidewalks that didn't have curb cuts. People know what a curb cut is? It's a little ramp so that you can get onto it if you're in a wheelchair. Sidewalks that were poorly maintained, had large cracks in them, or were otherwise not traversable. It also looked like sidewalks that just stopped in random places, right? All of these things are huge barriers for people who struggle to access public space and the connection, the interpersonal connection that it provides. So, this connection, right, is a huge protective factor. This is the connection between sexual violence and sidewalks. If we have sidewalks, people can connect to other people and through a variety of different mechanisms, right? Through access to accountability systems, to just having a safe place to go if they don't feel safe, right? Those are ways that having access to these public spaces can make their lives safer. So what's our next slide? One of the reasons we chose to work specifically with adults with disabilities is that Stone Belt in particular we've had an active collaboration with since 2008. There's been no change in levels of reported sexual violence, even though we've been doing direct education with those folks since 2008. Yeah? Right? So that's clearly saying what we're doing is not sufficient. We need to try something more. In addition, we happen to know, next slide, Monroe County, Indiana, which is where we're from, Bloomington, Indiana, it's in Monroe County, compared to similar communities, reports very, very low social support. So many people are reporting inadequate social support. We know that's a common problem in the community in which we live. Next one. In addition,
What do you mean by social support?
social support, people familiar with the phrase social capital?
Yes.
Right? So it tends to be measured through a variety of different questions, which involve questions like, do you feel like you have someone in your life who cares about you, a special person that you can talk to about your problems, right? So you look at a variety of questions like that that assess connection.
Community needs assessment.
Yeah. Right. And I can talk specifically about what kinds of questions are asked.
No, that's fine.
Essentially, yeah.
Evelyn, can I add to
Yeah.
that? So one thing, so I'm going to back up for a second. I'll answer your question, but what I wanted to add to this is that this is a CDC tool that anybody can use for any community in the United States to try to figure out how you compare to other cities just like yours. And one of the ways in which they measure social support, which is available on this website, you can see where they got the data from. The CDC did, but I just lost my train of thought. So they have all that information for you, so you can see which studies that they used and everything like that. Okay.
All right. Give me the next slide.
Yep.
Adults with disabilities in general, we know, are particularly vulnerable to sexual violence. So we're looking at people at the intersection of those two things. Adults with disabilities in Bloomington, Indiana, which is already known for having poor social support. It's the next one. We happen to know this not just statistically, yes, but also by the evidence that we've gathered as part of this project. And I'm going to let Tiva talk a little bit about what we did here and what this means.
This is a project we do in our group called Bouncing Back. It's the only group like that in Indiana. And it's a group that's not billed separately, so it's included in the day program I'm involved in. And every Friday we meet and we do the one up, one down, and then we have a topic. We gave these pieces of paper and had them draw their own circle. And this young lady, who wanted to use a rainbow as representing her name, she has her mom first, then her staff, then her wheelchair as support. And you know, this is a woman who cannot use She's in a wheelchair. She's beautiful. She's in a wheelchair like this. She has cerebral palsy, and she's in her early 40s, and she cannot do anything for herself. But she's up here. She's in really, really good shape. But anyway, to think that her wheelchair is a big support. Yes, it is great because without the wheelchair, she can't get around, and if she can't get around, then she's not going to be in touch with people. But for it to be, we were trying to convince him to talk about people.
Mhm.
But this chair, she says, without this chair, she said, I'd be dead.
Thank you for telling us about that. So one of the issues with regard to this project has always been transportation just within our own city. It was my biggest desire to bring some of the really vulnerable stakeholders that we have on this process with me to Washington, and it just wasn't possible. So what I've done is I've brought for you some photo voice projects from them, and I also did a few interviews. So I would like to introduce you to Mike and Sandy, if that's okay. If the audio is working, I would really enjoy for you to meet these two people who have been so instrumental in this project. And these are people who Tebow works with every day. She has the opportunity to hang out with them.
My name is Michael. I graduated from Ivy Tech Community College in May of 2011 with an associate's degree in computer information systems. My main area of study was web development. There was one day that I wanted to go into Laughing Planet. It's a burrito place, downtown Bloomington, Indiana. I could not get into it because there was steps up to it. It was in like an old house.
Yeah. So what frustrates you about going into Bloomington in the community? So there was about 15 minutes between my questions, I went off script, and his response, because he's
When I am in stores and things are in the way, it is hard for me to get through.
Yep. You found that at the mall when you were mapping the mall. That was frustrating. Yeah. Thank you for sharing that. Why did you only go to 7th grade?
Because of my health.
Because of your health.
I can't
Oh.
get up and down the stairs. I had to have somebody help me up and down the stairs.
At school.
Well, I'm trying to do my GED now.
Your GED.
Yeah.
What are some things that make it difficult for you to do your GED?
Well, the teacher did.
Why?
Well, I had for a little while and then I had to quit.
Okay.
So I had to get another one.
Oh,
And I don't know when it's going to be.
Well, I hope that happens soon.
The teacher said, well, why do you need your GED? I said, well, I feel like I'm not looking for another job or nothing like that. But I feel like I need to learn.
Yeah. Well, I think I have everything unless there's anything else you want to tell the audience at Washington, D.C.
I feel like it just takes to go on because I think that's what they want me to do.
Yeah.
I can't give up.
I like that.
That's tenacity. A 73-year-old woman who has
My
to
mate.
argue for her GED. And she does, very effectively. But not effectively to the outcome that she wants, because she's still waiting on another teacher. So
I'm going to talk a little bit about our project and our process. So here is where I get to tell you about the project. So I work at Indiana Coalition Against Domestic Violence, and my role, as I said before, was to really ensure that the state of Indiana is including what would be considered, quote, underserved populations. And I was just hired about 18 months ago. For 7 years prior to that, I had been at a local program working with Stone Belt since 2008, doing education with people with a variety of disabilities. And the only measurable outcome that we could detect was an increase in incident reports, so that's good, but there was no decrease in sexual violence among this population, so we knew that it was going to take more. It needed more of like a structural oomph, if you will. And so I was hired at the coalition, and then I had the opportunity and the resources to pursue an extra oomph. And so that's what I get to share with you today, and I really appreciate you sort of rolling through the technological bumps. I appreciate that. So anything that we do at the coalition, we ask ourselves some really important questions before we pursue a prevention strategy. And that's what this E4, the prevention strategy, means, is we ask ourselves, is the prevention effort going to be effective? For example, educating people with a variety of disabilities on relationships. Is that an effective way to end sexual violence for that population? The data says no. We ask ourselves, is the strategy going to be efficient? Is this a universal thing that is going to impact the largest portion of the population as possible? And so we think that our strategy is that. You also have to make sure that your prevention strategies are ethical. And so when I say ethical, I really mean, are you asking for change from the people who have the power to make the changes? Am I going into the classroom and asking people who have a variety of disabilities, who in many ways don't have a lot of control to the environment that they have? Are we asking them to change their relationship behavior and expecting then a reduction in sexual violence? That, on reflection, is not equitable. I approached my classroom back in 2008 from a perspective of like a highly ethical perspective, working with, but I was asking for them to impact a system that's much larger to them. So now we really feel like we need to ask if the strategy is equitable. Are we making changes to the most vulnerable populations, affecting the most vulnerable populations? So those are the things that we ask ourselves when we are considering working on a prevention strategy. So I started when I was hired with a literature review. What does primary prevention say about prevention with vulnerable populations? As you can imagine, I found quite a bit of teen dating violence prevention classroom, research on classroom, which is great, but that wasn't my population. I was looking specifically for projects in the United States that actively involve, not just research on people with disabilities, but research with people with disabilities. And there's nothing in the United States that has been published. So that's another barrier that we as preventionists face. We may have awesome community collaborations that are effective for our communities, but are we connected to people who can research the evaluations and then write about it? So it's a huge barrier just in our prevention field at all. So that's why I started with a literature review. I wanted to know what inclusion meant, not from an academic perspective, but from a personal perspective, the people who experience it. And there was nothing there, so I shifted to academia and read a lot about different definitions of social inclusion, and nobody agrees quite about the operationalization. Whoa! Yes. Of inclusion. What does that mean? So what I found in the literature is that inclusion needs to have a lot of different elements. There's rights that are important, independence, choice, control. All of those things feed the experience of inclusion, but it's not just control over what color socks you're wearing. It's control to have an effect on the environment. Are you making decisions that influence the group, for example, and not just yourself? The independence and choice, it needs to be both concrete and emotional. And so what I mean by that is there was a woman whose motor on her wheelchair broke, and it really impeded her mode of transportation around. So that is a concrete support that that woman needed to be included in the societal experience. And with rights and independence, this is rights that are exercised on the system. I asked people if they were going to vote, and there was a lot of upset because people didn't know if they were going to vote, or if they're, I heard more than once, what I have to say doesn't matter, so no, I'm never going to vote. So it's not just rights or independence over what color socks you wear or what kind of clothes you wear, but this is actual effect on the system. All of these things, rights and controls, both informal and formal, are really, really important with that, the population that we are working with. Okay, next slide, please. So this is the Bloomington, Indiana Inclusion Collaborative. What I did essentially was I went out and went to Stonebelt because I had a really good relationship with Stonebelt, having worked in a local program, and I asked the people in the classroom who I knew Tiva, I knew some Stephanie, I knew some of the people who are clients who were in your room. So I went to your room and I asked people, do you want to work on a project that increases inclusion for people with a variety of disabilities? And got a resounding, yes, let's do it. So I approached the leadership at Stonebelt and they said yes. And so after that, I just tried to recruit as many different local agencies as possible. So what resulted in that was a multidisciplinary, cross-sector, multi-ability, multi-generational collaboration of 9 different local, state, and national agencies to be on this project with us. And our task was to think about and reduce the risk factor of social isolation in Bloomington, Indiana, and lift up the protective factor of social inclusion and support in Bloomington, Indiana, because we score very, very low on that nationally. And so that's what we did. And I want to tell you a little bit more detail about how I did that. I will speed through the next slide, maybe? Yeah. So just so you know, if you're interested, what I did was I emailed people first with an executive summary of what we were going to do, including the amount of time that people who would collaborate with me would spend on the project. So I was very transparent. I said, I'm asking for an entire year of your time. This was back in February of 2015? Yes.
2015,
yeah.
Yes.
And so it turns out that if you show up looking like that with the huge eyes and just like so excited, people don't say no. So I followed up with that email. I followed up with a personal appearance after the email. And only one agency said no. And I asked 9 different agencies. And so I got another one. So that was fine. If you want to go back to that one. So this is the really important stuff. You have to do assessment to figure out what the barriers are in your community. So these are the different forms of assessment that we did throughout the entire first year of our collaboration. And we were successful in getting another year of funding through RPE. So now we're in the second year of that project. So we did network self-assessment. You saw the circles of support. we found anecdotal evidence, if you want to call it that. If you want to put it in the academy, it's anecdotal. But for our purposes, that circle of support you saw earlier, that was pre-intervention measuring a support network of a very vulnerable person. So we had everybody do that. I did pre and post tests for all of the working professionals on the collaboration around the importance of support and inclusion for people with a variety of disabilities. What I was looking for there was beyond the emotional support in those things. And so pre-intervention, there was a lot of they need social work, they need, people need a vocational rehabilitation person, very like individual level located supports. And after the intervention, people started putting in more structural answers like rounded curb cuts and access to mass transportation that's just beyond medical, because a lot of people, if they're hooked into this system, can get free rides to their doctor and from their doctor. But it's important to be able to go wherever you want to feel included. We did key informant interviews with as many caregivers in Bloomington, Indiana as we could get, both within the Stone Belt agency that we partnered with and in the community, including parents. We did focus groups with people with disabilities, which was really cool. I enjoyed that. We did photo voice. So for the participatory social mapping of area public spaces, businesses, and neighborhoods, we had the agency working professionals partner with the people who receive services at Stone Belt to go into the community to physically map and assess barriers or things that made it really awesome to be there in the community. And so every person who went out on excursions had a camera, and we collected more than 300 images. And I will, if we have time, show you a little snippet of the photo voice and the participatory social mapping. And we are going to share all our tools before we're done here. It's our hope. Okay, next slide, please. So what you see here is a picture of the social ecological model. All right, for people who are not familiar, can you raise your hand? Okay, one person, sorry. So what this model does is show the different dynamic levels of society. It's hard to see because it's so small, but you'll see the individual. You're good?
I'm good.
Okay.
I can probably figure it out if you go on.
Right.
I'm good.
Okay. So this is just a short list of the things that we worked on during the collaboration. And I feel that it's very important to convey to you the necessity of both active interventions, which are the classroom things, and passive interventions, which are things that we don't even really have to think about because they're there in the environment. So, for example, in order for me to be able to have a really close relationship with people with a variety of disabilities, I needed to go there and be part of their leadership class to develop rapport, to gather data, and to be part of the lives of people who I was asking to spend so much time with me. And so we did a lot of relationship building, both together, me in the classroom, and the 20 collaborators from Stone Belt and the 14 agency professionals. We met somewhat, not often. I wish it was often. But we met a lot so that when people went out on excursions into the community, they felt comfortable talking about things that were hard. That was really important. Cross-agency trainings is something that we're doing this year. Since there are 9 agencies that have different, really great things that they do for the community, they're cross-training each other on what they do to help to serve people with disabilities. And so they're learning how to make their agencies more accessible, but also just how to interact with people who have a variety of disabilities that it may be, some people who have never interacted with people who have disabilities kind of feel flabbergasted and like, I don't know if I'm gonna offend you, and I'm anxious and you're anxious and we're strangers. So we did a lot of relationship building to increase competency and reduce stress. Another active behavioral thing that we're working on is the systems advocacy. I try to go to as many city meetings as possible to share the data that we collected. And the GIS is something that needs to be updated all the time, and I will share that with you soon. So in order to get environmental redesign, we needed to spend a lot of time with the agencies. I want to share with you all of the data that we found. And we found hundreds of barriers. We had basically a stack like this, front to back, bullet pointed just like this, full of barriers that we found by going to 9 places. 9 places and hundreds of barriers. So I want to share with you some of the barriers. I don't know that I'll have time, so I want to say it now. How do you share that with people? It's overwhelming if I were to just sort of hand this to you and be like, here's the barriers. It's not great. So there's handouts around. This is one of the ways in which we are visualizing the data for people to sort of take a chunk and understand. These are throughout the room, so you can pick those up. So what did we found? We found that most of the sidewalks, most of the bus stops that were not located on the Indiana University campus looked a little bit like this. Bloomington gets a lot of rain, so they were really muddy. Generally, if it's not an IU property, some of the infrastructure just really isn't built in. And so this is Jay. Jay's illustration of what it's like to go to a bus stop with her friend who's in a chair. And Jay gets a little bit muddy, but she stays fairly dry because she's vertical. But her friend is sitting in a chair and actually has to get really super duper wet. And then when we got to the mall, because we wanted to make this as real as possible, we didn't get a company car. We went out on the street and rode the bus. And so once we got to the mall, the electronic door opener wasn't working. And we literally just stood there because Michael was with us and he was leading the excursion, and Michael has some dexterity but isn't able to open a really heavy glass door, and he's in an electric wheelchair too. So it's quite hard. So we stood there and waited for people to let us in, and I'm sure that was, lots of people passed us. They did, we pushed it. No. But it works now because of Tiba. She wrote lots of letters to them. Yeah, that's just one. Okay, next slide. So, public library. The public library was mapped by a woman who is blind. And this is a really, really neat and interesting perspective. If you can get that on your own agency, I highly recommend it. So essentially what happens is she walks into the Monroe County Public Library and she's immediately lost. And I asked her why, and she said that it's so open that she can't see. She needs that air bounce back on objects in the room. So she couldn't see. The other side of the library was a little bit better, but there was no differentiation of texture on the floor to guide her through the library. And so essentially the library is not a really welcoming place for people who are blind. If you will go to the next slide. So this is some of the photography from the visit to the museum. Tasia is a young woman who's there with her staff member Carmen next to her. Tasia is in a wheelchair, not because she can't walk, but just because she has so many seizures that it's dangerous for her to try to stand up and not be tied to someone. So, but for her to be able to enjoy the art, she had to be standing up. And so Carmen had a tether that was tied around her to Tasia, and Tasia had a fantastic time walking around the museum and enjoying the art. And Tasia is a very famous artist in Bloomington, Indiana, by the way. And so I love this image. There were no other problems other than if you're shorter than about 4 feet, you can't enjoy the art at all. Next slide, please. So here's some of the experiences of some bus stops in Bloomington, Indiana. In the lower right-hand corner, probably if I hadn't put that arrow, you couldn't see the bus stop. This is actually on an incline, so if you don't have an electric chair, it could be very dangerous for you. There's also no sidewalk down there, so people have to literally wait in the street for the bus. So this is Photo Voice.
Broken side. They got a lot of broken sidewalk and they need to fix it because it's dangerous for people who walk on it because if there ever earthquake then it's just gonna fall to pieces.
My neighborhood has the roads like that.
Oh no.
And it's dangerous for me since I'm one way. I can't I'll trip over those.
Thank you. So those are just some of the stakeholders that have been working with me for almost 2 years, who really wanted to share their voice with you today. We promise to spend some time with you on our tools, so we're going to shift over to that. And I would love, Evelyn, for you to talk about.
So we do want to talk about some of the tools that we use, because it's probably sounding really, really complicated. Here, next slide. We want to talk about the Circle of Support as a social mapping tool. People know what that means? Right, so connections between people, connections between places aren't just physical, they're also social. This helps us see where people connect to others, who they look to for support, and it's actually one of the assessment tools that we use to see how many people show up on their circles of support.
We're going to have to skip all this. I'm sorry. I really want you to...
All right, so we've got lots of tools. It boils down to we used several different surveys. We iterated it. Some of them worked, some of them did not, right? So that sounds like a lot of work. Can you go back one?
Yeah, I sure can.
Right? That sounds like a lot of work. It is, right? But not all of us are doing this for grades. Some of us are doing this because we do it for the warm fuzzies. I do it for the warm fuzzies. So you can come up with your own questions. What do you want to know about your space? So I asked a question about my own agency. What's the difference between how staff view the agency and how residents view it? And I did that essentially by getting a fire evacuation map, tracing it very, very large, and giving people Post-it notes to write on and stick on the map. So I got a number of different comments. I would recommend this is online. You can pull it up. It's a little easier to read there, as is the next one, which is resident and staff. A lot of you are probably thinking, well, you work there 8 hours a day, right? You know the space. One of the things we learned is that we think of the space differently. A consistent conflict, consistent mismatch. You realize this room down here in the bottom left is an exercise room. It's got equipment in it. The equipment is not in fact broken, as staff says, which is a mismatch in expectations. We assumed that nobody used it. That's what several people I spoke to said when I asked them about the room. If you go to the resident comments, what they said was that I never used it, but I'm glad y'all had it for us. Right? People perceived it as an amenity and a thing that made the space more welcoming when, frankly, good weeks don't end in a domestic violence shelter. Right? It was a nice thing for people to have. So I did that just because I came up with those questions and came up with my own idea. You don't have to use the tools that we give you, although they're really great. And I'd like to highlight one tool.
This?
Sorry. This is one back. This is a different thing that we did. This is our direct services area. So my office is there. Our case manager's offices are there. A consistent complaint that we did know about was that this area is boring. Residents come down here. They often have to sit with their children while they wait for a case manager to free up to talk to. And what we found is that kids get rowdy when they don't have anything to do. That seems really obvious. So what do? That office there on the left is mine, or it used to be. It's not anymore. What I did was move those chairs in front of that window, and on the bottom two windows, I papered behind them with white and just left markers out there. Kids could scribble all over the windows. They could draw all they wanted. Right? They get to draw on a wall. It was fun for them. It was different. Right? And that was a way to make that space less boring for young people. Adults, read books, whatever. Right? But 4 and 5-year-olds, that was a way to make that space less dull, in a space where there's a lot of waiting.
And I was going to add that this mapping activity that Evelyn did in the Rape Crisis Center is a form of trauma-informed practices that agencies can do to reduce the rule breakage factor, if you will.
Yes. All right, so I want to highlight a tool that I came up with while I was working on some other stuff. Yeah, it is on the back of your handout right here. It's a way to think about different spaces. And it's a way to look at the different ways they're constructed, structurally, sensorially, and socially. I would like to, if we had time, do an activity where we actually map the space we're in. Unfortunately, we're kind of crunched. So I'd recommend, if you feel like it, if you find this interesting, take some time, look at the map that's in the back of your Spiral Hound book. It's got a map of the convention area. Ask yourself some of these questions about some of the spaces. I can tell you right now, different rooms have slightly different setups. These chairs are actually not super accessible for everyone. They have problems, especially when they're so close together, for people of size. I call myself fat. I'm okay with that. Many people aren't. Yeah, give that some thought. Also, feel free to take a look again on the online resources. I have a list of some different accommodations that you might consider.
And I just want to interject here for a moment. So this is another way to visualize the data for people when we are advocating. This is available for you for free. This is Google. And all you do is you create a Google map. So Michael, who you met earlier via the interview, this is his contribution to the project as well. Not only did he go out into the community and assess different areas with other people from different agencies, but he created this GIS map for us. So if you go to Google and you Google the phrase Bloomington Inclusion Collaborative Map, lots of our stuff will pop up. This will be number 1. You can interact with this. Michael, whoa, what happened there? I wanted to show you, so when you click on some of these things, data should pop up. So he's still working on putting photo voice in there. So you can see here that there would be 2 photos if the technology was working that would pop up, and you can see the barriers. So this is something that we gave the city planning people. Look at Bloomington from the perspective of somebody who's rolling around in a chair and see just how terrible your roads are for people who have different levels of mobility. So our results. So there's lots of tools for you online. We gave you everything that we created, all of the mapping tools, all of the different devices that we use to measure both social networks and actual physical networks. Here's one of the things. So the library learned that these are death traps. These are the 2 very large stairwells that don't have a lot of transition for people with low vision or who are blind. So to increase safety, we have recommended that the texture change happen about 3 feet out rather than just like 6 inches, how it is. So what I mean by that is this is a different texture than this. But once you figure that out, you're already on your way down the stairs and not the way you intended. This is also a very beautiful curved stairwell, but the problem is on one side of the stairs, the step down is very narrow and it goes to wider. And so the woman who was blind, that was just very hard for her to go down those stairs because it wasn't standard stairwell like this. So we've recommended that the Monroe County Public Library change that, and they have agreed. So it will make it safer for patrons of all kinds to go into the library. Another thing is they have accessible computers, but you literally can't get into the accessible part without you visually seeing and being able to type in. It's not fully accessible. It's only accessible once you log into it, which is sort of ridiculous. So they are setting up a whole bank of all the way accessible computers. And not only that, but we saw a 200% increase in the working professionals understanding that structures matter to reduce violence on the post intervention, or I should say midway intervention at the end of the first year. So something that we've seen a lot that's caused a lot of anxiety at Stone Belt is more people are using mass transportation, because all of the transportation providers who are mass transportation providers in Bloomington, Indiana are on this project. And so they had an opportunity to meet the people who make the transportation happen, to go on these excursions into the community using the bus. Now people can be more spontaneous with their day. They don't have to call up the medical bus ahead of time. And so it causes a lot of anxiety, because that's more independence. And I think maybe the CEO at Stone Belt, when she said, now you're making them more vulnerable, I think she probably thinks, yes, right. She probably thinks that if there's a caregiver there, nothing can happen. But we all know the statistics are saying that the caregivers are the problem. So, I mean, not all caregivers. That was rude of me. I'm sorry. So something that I thought was really important, and something that I noticed, so I created this really, really intricate, actually I didn't create it, I was going to use a tool that would have taken 2 to 5 hours with each individual person to figure out their social network. This was the compromise, because I didn't have that much time. So people were misconstruing staff as friends and intimate, close friends, but not intimate like bear, but just like, you're my good friend. And that's a problem. Their staff, if it's your friend, they have to tell you why they don't show up. They don't have to, but they generally care about why they don't show up in your life. People who are staff are held to a higher standard, and if you know a person is a staff member and you know they're held to a higher standard, then you should know the procedure to advocate for yourself. So I felt like it was really important for people to put staff where on that circle of support that they really were. They're paid. They are paid to be in your life. And this is not how we talk about it in the classroom. I'm just trying to hurry. So on post-intervention, we found some of our partners who appear on there, and the correct attribution of staff to the right part in the circle that would indicate a commerce and exchange, like you're paid to be here. Therefore, if I don't want you here, you don't have to be here. It's very empowering for people. I'm going to skip through this. This is some of our other stuff. This is another way for me to visualize for an audience the data outputs across the social ecology. It's worth looking at if you're interested, but I don't feel like we probably have time. So this, I feel, is really important. This slide is all about what we could have done better. So the relationship building needed to be more how you, Stephanie, had suggested, or maybe, ma'am, it was you, Sarah. Somebody over there said, well, the meetings, was it just you with the people with disabilities and then you with the agency? It needed to be everybody all the time, period. Like you said, and it couldn't. The transportation was a barrier throughout the entire process. One trip to somewhere 2 miles away took 3 months of me pushing and pushing and pushing to make it happen. And that's how we assess the neighborhood.
So,
yes?
on that first mention about relationship building, one consistent issue that we found was that the increase in competency, so the professionals felt more able to work with people with disabilities, the converse was not true. People with disabilities that we work with did not feel any more comfortable with professionals, right? So that is,
Except for me, because I'm there all the time.
so that's a really important thing to recognize, that our systems, if they work for professionals, but they're not necessarily working for all the stakeholders, that's an issue.
Yeah. Absolutely. And something that we should have required was that every agency needs to look inward to their own processes. It should be something that is a part of every single agency to see what their ADA compliance is, and also their understanding and ability to serve people with a variety of disabilities. That is going to be part of the next round if we get lucky enough. One second. The data collection process. I should have had an observational evaluator, and also the people who are doing the mapping. I would have been able to have more data about barriers. What I didn't anticipate was that people who had not been out into the community, who had never been asked what could be better in your life, can't identify what barriers are because they didn't know what was possible in the first place. And so that was interesting and hard for me to come to the realization on. So we needed, in order to get more data, I would have had 2 levels of data collection out on those outings. And something that I didn't catch your name from New Mexico, but you said this morning in your session, was that sexual violence prevention takes a very long time. Totally agree. So it's really hard to slow down when you get your money after 1 year, you know, and then it ends in 1 year and you don't know if you're going to keep going. So we were lucky enough to get a second year of funding, and now we are in the implementing solutions at this point. So we are advocating for sidewalk connectivity, and we are advocating for the changes in Monroe County Public Library. Despite the fact that we found hundreds of barriers, we had to start somewhere. Do you have anything else to add there, Evelyn? Tiba? So this is our contact information.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.